Hi guys, welcome back to Codemaster Coach, your medical coding tutor. We're continuing our series on the study of the 2019 ICD-10-CM coding guidelines, and we are down to 1B17 on borderline diagnoses. So first let me show you the guideline. It says, borderline diagnoses. If the provider documents a borderline diagnosis at the time of discharge, the diagnosis is coded as confirmed unless the classification provides a specific entry, for example, borderline diabetes. And if a borderline condition has a specific index entry in ICD-10-CM, it should be coded as such. Since borderline conditions are not uncertain diagnoses, no distinction is made between the care setting, inpatient versus outpatient. Whenever the documentation is unclear regarding a borderline condition, coders are encouraged to query for clarification. And remember, query means ask your physician. Send them, they usually have a set form to query a physician with. All right, so what is this exactly saying? If you had gone to the doctor and your doctor says you have borderline diabetes, that means evidently for the last couple of visits, either your sugar level has been high or low, or even if it had run an A1C, which is a lab that calculates and tells you about the average of what your blood sugar has been running for the last 3 months. And if it's been running high, the physician tends to know to watch you closely. Because when he says borderline, that means something's going on and he knows he needs to watch it. So if that condition, whatever it might be, is considered a borderline condition, then your physician is going to use the resources to monitor or check or oversee you for the condition. So you might as well code the condition as confirmed if your physician says that, and if you cannot find it under the main term borderline. So let me show you in your code books how to look up borderline diabetes, and you know how to do it. Pull out your code books, ICD-10-CM, look under the main term borderline, and as you'll see, there are some conditions under borderline. There's borderline diabetes mellitus, hypertension, osteopenia, pelvis, and personality. So there are some conditions here already under the main term borderline. And so just remember, if your physician diagnoses your patient as having a borderline condition, go under main term borderline and see if that condition is there. And if not, then just go to the condition itself. Okay, guys, that's it. I'll see you in the next one. Thanks.